So with the Concept Facelift, you typically do not have any bandages, you don't have any drains, which is quite different to a traditional facelift. The other difference is that the traditional facelift is more invasive. The scars are much longer. They start from the top of the head, they go in front of the ear and behind the ear and at the back of the hairline. With the Concept Facelift, I avoid going into the hairline, so the scar is a much shorter scar. It's less invasive, less traumatic for the face, and it means there's less bruising, less downtime, less swelling that you wouldn't have with a traditional facelift. Typically with a traditional facelift, you're looking at about 6 to 8 weeks before the bruising and swelling is settled, before you can even venture out to a supermarket. With a Concept Facelift, you're talking about a few days to a week before you can get out and about and get on with your daily living. The risk of a traditional facelift is that with having the scars in the hairline, typically about 30–40% of patients end up with hair loss in front of the scar. For a woman, that can be quite distressing. If the wind blows, if they go swimming, they're very self-conscious that they've got a bald area in front of the scar. And now the scar is more visible because of the hair loss. So by avoiding going into the hairline, there's no risk of hair loss whatsoever. The other difference is that with the sutures that I use, they're all absorbable, buried under the skin. It means that you get a much finer scar than you would otherwise. With a non-absorbable traditional facelift, they have to come and have the scars removed, the sutures removed, which can be painful, and they will leave unsightly scars and more visible scars. So these are the differences between the two techniques. So with the Concept Facelift, the end result, the longevity will be the same, come 3 months and onwards. But in the first 2 or 3 months, you can have a much safer, more rapid recovery, much better scarring, less pain and discomfort from sutures or bandages being removed. And patients tend to find that it fits much better in their daily living. This technique, since I've developed it, has massively increased in popularity, often because of forums where patients have explain their experience and how it's changed their lives. As a result of that, we often have lots of international patients that come to see us because they rather have a week in England to have the procedure and go back than to have the traditional method with risk of hair loss, with pain, with downtime of 6 to 8 weeks, which in today's living is just not acceptable for most people.